Awesome. Thanks, Arius. Mary, would you mind going to the next slide? Perfect. And so this workshop is going to be the part 2 ILRU ILNet workshop on filling the gap. And I will introduce our presenters. Next slide, please. First, we have Daisy Fight. She is the Executive Vice President of Access Living, Chicago Center for Independent Living. She has worked at Access Living for more than 15 years and has held a variety of management positions. We also have Seth Hodorowski, who is the Director of Transition Services at Lehigh Valley Center for Independent Living, LVCIL, where he has worked for 9 years. And he has worked in the social services field for over 20 years, with the last 9 years directly in the field of transition. Also joining us is Joe Mitchner, who is the Director of Employment Services at LVCIL, where he provides operations and fiscal oversight for several of LVCIL's transition and employment programs. And then Patricia Yeager, who has been working in the disability rights and services field for over 40 years and is the CEO of the Independent Center in Colorado Springs. And also, I'm Brooke Curtis. I'm the Associate Director of Training and Publications for the ILNet at ILRU, and I'll be moderating today. Next slide, please. Perfect. So what you will learn in today's session, strategies and practices to assist your organization in shifting from identifying the gap, which was the part 1 workshop, to program implementation. You'll also learn how to utilize data for program evaluations and to assess the success of programs. Next slide, please. Perfect. Patricia, I will go ahead and turn things over to you.
Too many buttons here to push. Well, welcome everyone. Welcome back if you joined us from the first presentation. If you haven't, I think this will still make sense as we talk about program design and implementation, or at least that's my part of the presentation. So I'm Patricia Yeager, CEO of the Independent Center in Colorado Springs, and my pronouns are she, her, and her. Next slide. All right. I don't know about your center, but in our center, sometimes it felt like we were in a popcorn popper, and everybody had ideas, and let's do this, and let's do that, and they all sound good. And you want to say yes to everything, and then your staff is pulling out of their hair because everybody's involved in all these different projects. So we decided to start we worked on a vetting process as a way to calm the popcorn kernels down and have them pop one at a time. It takes a little time, but in the end, you will have a much better experience and know which programs to start and which ones not to start, or even ideas. So we start with a form. And this is, by the way, a handout. All of this is in your packet. We start with the form. The staff person with the idea starts with this form called the 5 W's and an H. And they fill it out. Now, maybe it's a team of people, maybe it's a manager, program director, and the staff person. But what's your idea? Who does your idea benefit? Who will it impact internally? So if you're planning a workshop, are you going to take half the staff to do it? And how will that be the impact? When can your idea be implemented? Is this a class for the spring? Is this a business that's going to take about a year to bring up? So having an idea, it's answering these questions, getting people to think through these kinds of details. Where'd your idea come from? One of my marketing director at one point several years ago had an idea that maybe we should do ASL interpreter referral as another source of income, which was pretty interesting, and we've been working on that. But that's where that idea came from. Why is your idea necessary? If you want to offer a sign language class to staff, why is it necessary? What's your thinking about this? And how will your idea be implemented? And this is where people get to learn how to do planning, program planning. Is it easy? One person job, like we're going to do a class for I don't know, we're going to do a support group around people having trouble with accessing healthcare. Now that's an easy, probably one person job, might not require a lot of resources. Or is it we're going to set up a business and it will require numerous sources. So that helps people get a grip on their idea and get their feet on the ground. The manager and the director, and sometimes the whole leadership team, will review it and decide which way it goes. Is it an idea plan or is it a business plan? That way the person doesn't get through all this and then to be told, no, we don't have money, or no, it's not appropriate, or it should wait till next year. We don't want people to go through a whole lot of work without having some red light, green light opportunities. So this is the first one. Next slide, please. And we call this our vetting process. Once you do that 5 W's and an H, you either have an idea plan or a business plan, or maybe you're told, we can't do this now. And so in your attachments, I'm calling it packet, you have an idea plan workbook and you have a business plan workbook. And we've done this to make it easier for staff to work through the process of answering these questions before we say yes or no. And they're very much the same. The difference is how much detail. So the first step is to identify the gap. Now, you talked about community gaps with an S earlier today. This is a gap. So one of the gaps we worked on was one of our community transition staff came to me and said, hey, there's too many people in nursing homes that don't need to be there. And we began to research that. Why were they there? How did they get there? We identified the gap. We looked at what could our role be? And how can we change that dynamic to keep people from going into nursing homes? And so we did a lot of writing around identifying the gap. We want to keep people out of nursing homes so they can go home and heal at home. Well, who would be interested? Who would pay for that? That's the kind of questions you're going to see in the business plan side of this process. Once we identify the gap, then we really go into detail about program design. Who's going to do what? What are the steps? How much time will it take each staff person? How much does it cost per hour for each staff person to do the work? So we develop a plan. Going back to identifying the gap, I want to mention you're doing market research here, and you're asking your customer, who's the customer? The customer is the person who pays for it, and the beneficiary is the consumer. So you have two competing, not often competing, but you have two different customers that you have to satisfy. We went to the hospital and talked to them about their complex cases. That's what they call people who they have trouble discharging, and got lots of information that helped us in our marketing and in our evaluation and helped us in developing the program plan. So that identifying the gap, the program gap, is very important. Design the program, then you begin to look at the finances. How much does it cost? How many people do you need to serve at a cost per person in order to make the program sustainable, break even, or even provide revenue to your organization for other projects? Then we talk about marketing. How will we market this? What information do we need? What data do we need to collect? What do we do? Advertisements on billboards? What's the way to reach our customers? Which is why it's so important to identify who is going to pay for this, because they're the ones that are going to enable you to offer the service. And, and then the last piece is evaluation. When you've been talking to your customer, to the hospital, we knew that they wanted us to help people get out of the hospital on time or early and go home and heal correctly, not come back for a readmit. Those are the 5 steps of identifying or doing a vetting process. Whether it's an idea, you still go through the same steps, but not to that in depth. You might not have to do much marketing. You might have a simpler evaluation plan. But if you're setting up a service, you want to know before you set it up that what it takes to make it successful before you take the leap into doing this. You want to look at all your risks, you look at all the details. Let's see if this vetting process is what we use to look at all new programs, all new ideas before we start anything. And it has helped us identify programs that we really couldn't sustain. We've also done this process with our existing program and have closed the program. We've closed a program, we've improved programs. One of them, we did research that showed that we weren't getting enough money from the state. And the state, believe it or not, increased we showed them exactly why we couldn't do it, make it with the reimbursement. They increased it by $5 a month per person, which gave us enough money to break even on a housing voucher program. So this information is really powerful to help you in setting up a program. You have a workbook, 2 workbooks, the idea plan and the business plan. You can walk through it because it's all the questions we put down to help you. If you answer these questions, you'll come up with a idea plan or a business plan that you can act upon and know why you're accepting it or why you're not. I'm wondering if there's, well, I guess we'll get to questions at the end here, but we are very, very open to helping you with this. And we've done it now with about 6 different programs in our center. It has truly helped us to streamline, to look at what's helpful and what isn't. So it's been a great process to go through. And that concludes my part of the program for now. I think we're going to go into how does your organization approach program implementation. And I know that the other speakers have stories of their own to tell.
Yep, perfect. Thanks, Patricia. So now Patricia's provided that great overview on how you move from identifying the gap to program implementation. And we are going to move into our pre-slated questions for our panelists. So the first one is, how does your organization approach program implementation?
This is Daisy from Access Living. My pronouns are she, her, and hers. I can take that one first. So ours is pretty straightforward. So I don't know how many of you were in part 1 of the presentation where we're talking about identifying the gap. But when we get to working on implementation, we've already gone through a pretty involved process to get information from a wide variety of stakeholders and looking internally at information that's helping us figure out what gaps we need to address. And then when we're in implementation, we already then know a specific gap we want to address. And the way we approach this, so we've already done that very involved kind of stakeholder process. Implementation is very much a staff process at Access Living. We make sure that it involves staff at all different levels and often across departments, depending on what the issue is. And we basically get, it's a group process initially to fill out a form, an implementation plan that we have been using for quite a while now, which just outlines what the goal is, outlines key activities, outcomes, tools and resources that are going to be needed in order to implement the program. It outlines what organizational functions are going to have to be involved, so what departments. We actually get detailed into different milestones, usually by quarter, that we're hoping to see with the program. We're talking about who's accountable for the actual implementation, both who the lead person is and then who are the other staff who are going to be involved. And what do we think is going to be the start and end date of the implementation plan? So that gives us then a blueprint for us to move forward. And of course, that's not a static document. We hit barriers along the way, as it always is the case in this kind of work. So we need to think of that as a living, breathing document, but it helps set the course, at least initially, for how we're going to implement the program.
Thanks, Daisy. Patricia, Seth, and Joe, do you want to also answer this question as well?
Yeah, I can add in. This is Seth, and it sounds like we take a similar approach to what how Daisy kind of goes about things at Hearst still. Some of it comes back to that whole strategic planning part, and the information specifically in there. But there's typically things written in service contracts of who's going about things and how things are going to be and how things are done. So things are really spelled out as to how we approach that program implementation and activity. So it sounds very similar.
We start the video here. I think the process I've outlined really speaks to all that. We do have we try to have a team of 4 people. It's the business plan, and the financial manager, financial guru in your center is critical to all of this to help make sure that we visionary dreamers have our feet on the ground in terms of money and what it will actually take to do this. But it does take a team of people to do this kind of approach. And you really, you got to be careful. You can't do 4 or 5 of these all at the same time unless you have a quite large staff. It helps to do this one at a time. And as your staff get used to this process, you're teaching them program planning, which is a great skill to have.
Awesome. Thanks, Patricia. Our next question on the next slide. So capacity, finances, resource, etc. How do you make sure you have these key elements in place? Daisy, do you want to start us off again?
Sure, I'm happy to. This is a really key question, and I would mention a couple of things here. One, usually when Access Living is going about our implementation plan, part of the activities in the implementation plan actually speak to this. So we just did a strategic plan refresh like 6 months ago or so, and we have a whole new area that we're focused on economic justice and opportunity. We don't have any direct service or policy staff or community organizing staff who are working specifically in that area. So one of the first things in the implementation plan is find funding to actually have the positions on staff we're going to need in order to implement that project. So I think that's one thing. The other thing I would point to is, especially if this filling a gap is derived out of a strategic planning process, that's a broad process. And we talked about this in the last session a little bit, but that really should identify which things you need to let go of. And so hopefully if you've done that process and really taken that part of it seriously, you might have identified some programs that you do need to let go of, and that might open up some capacity among other staff. And well, I'll let Patricia add to this, but I like what Patricia was talking about in terms of just getting really detailed about how much programs are really going to cost. So you have both in terms of money and time. So you have a really good idea of what it is going to take in order to, get a new program up and running.
Let's see. When we were doing hospital to home, we had a spreadsheet, or not, it was a chart, flow chart that, the flow chart, the end all flow charts of what happened when the person came in, how they got there, how did we get them as a consumer patient in the hospital, the assessment of needs with all the way through going to their home and checking it out for access and safety, and bringing in home health assistance, OT, PT. I mean, we had to set all of that up and make some decision about, in the first 2 weeks of this program of being home from the hospital, it's probably going to be more medically oriented than independent living. So we had to kind of get a range of how many hours would OT or PT or any kind of professional help like that be available. And then how much did it cost? And how much did it cost week by week? It was exhausting. And it was overwhelming to me because I don't deal well with all those kinds of details. But having program staff and financial staff involved, they were on it like crazy. So it's important to have different perspectives on this team to figure out, can you do it or not? And sometimes, and you also have to have a champion for the project. We would love to start an ASL referral business, but right now we don't have a champion for it. And so we're putting it on hold until we hire a new program manager. We have a vacancy in the organization. So we'll wait till we have that champion who's taking this on, this program, to make sure it goes forward. It's critical to making sure the program actually happens. And I will say, the planning team needs to meet. We met weekly for probably a good part of a year, if not more. Every Wednesday, 11 to 12, the team came together and we met weekly with what do we find out? What are we doing? That communication, having someone who can help you with the communication of all of that, tracking it, is pretty important too, if it's a big program. Seth, you have something maybe?
Yeah. Much agreed on all of that. And, I think as we've done things, seeing that having financial folks that understand a little bit about programming, and programming folks having a little bit of understanding about financial aspects is very helpful and beneficial. Like that has been one of our key things over the years. And like Patricia was saying, really taking that time, that initial time up front, lots of meetings, lots of discussion, lots of looking at every single point so that everything to get things, especially when you're getting things started, is in place and costs are covered, and really almost over communication with that to make sure that things are done and looked at.
Awesome. This is great. All excellent points. I did also want to mention, and Mary put this in the chat, that if you have any questions at any time, feel free to drop them in the Q&A, so that way we can have the presenters answer them. And now we're going to move to the next slide, which is, why is program evaluation important? And Seth and Joe are gonna cover this. So Seth, I'll turn it over to you.
I'm here, Brooke. So this is Joe Michener, LVCIL, pronouns are he, him, and his. We wanted to spend a little bit of time just talking specifically about program evaluation. And, we've talked about program design, finances, marketing, all that stuff that goes into that. And that's all so important. But I think we can all fairly say that the most neglected aspect of program design or implementation is often program evaluation. Typically, we start programs and services and we get to the end of that first year and we go, okay, how are we doing? And that's not a good way to do program evaluation. We know that also that many of you have experience with program evaluation, but it's just something that is so important that you start thinking about right away. And it's got to be part of your program design from the beginning, because even when you're talking about something like budget, you have to budget time for program evaluation. It's not just the staff time to provide the services, but you have to have that worked into your budget to make sure that you have time to do good program evaluation. So Brooke or Mary, if you could go to the next slide. Oh, next one, please. Oh, back one. This is the fun part. Okay, so program evaluation, we know, many of you know the value of it, but we can't express or stress enough how important it is. Without program evaluation, you really have no idea how your program is really doing. You won't know if you're truly addressing the gap that you identified at the beginning of this of your process, and if you're really doing anything to close that gap. In addition, as the slide states, good program evaluation helps you in a host of ways, especially regarding improving your program over time and making it even more effective, marketable, and even profitable. So as the slide says, good program evaluations assess program performance, they measure impacts on consumers and communities, and they document your success. With this information, programs are better able to direct limited resources to where they're most needed and most effective in the communities. Knowing more about both successes and not so successful endeavors enables you to make positive changes within your program. Next slide, please. So there's lots of myths out there about program evaluation, and there's 3 on the slide for you. One says evaluation is a useless activity that generates lots of boring data with useless conclusions. And I would say in some cases this can actually be true. But if it is true, it's the result of poorly determined evaluation criteria, which we'll talk to you about in a little while. It becomes a myth when you have the right data points and information. Second one says evaluation is proving the success or failure of a program. Evaluation is a lot more than proving success or failure. It's about consistent improvement and avoiding stagnation. And then finally, evaluation is a highly unique and complex process that occurs at a certain time in a certain way, and almost always includes the use of outside experts. It is true, evaluation can be very complex, very difficult. There are courses on how to do it well, but if you can simplify it and choose good indicators and questions, you can actually do it on a level that makes sense for your organization. All right, next slide. Okay. And I'm going to ask Seth if it's okay for him to jump in on this slide for me.
Yeah, sorry about that. My mouse wasn't working and my arrow wasn't hitting my stop video view thing. So my apologies. So program evaluation, what it really is. Program evaluation is careful collecting information about program or some aspect of a program in order to make a necessary decision about the program. So evaluations can include a whole bunch of different things, at least 35 types of evaluations, such as things like needs assessments, cost benefit analysis, effectiveness, efficiency, formative, summative, goal-based process, outcomes, and a whole lot more. The type of evaluation you undertake to improve your programs depends on what you want to learn about the program. So now this is where we have to preface the rest of this presentation. The fact is that we could spend days in professional training to learn about the complexities of systematic and scientific program evaluation. Some of you may even have the knowledge, and that's wonderful. But we're not going to cover that in the next handful of minutes, and nor do we expect that level of program evaluation necessarily occur. Instead, we're going to lay the groundwork for foundation for you about program evaluation, give you some tips and tricks for successful program evaluation, and then look to you to reach out if you need help or more information on this topic. Next slide, please. So with many things in life, we want to keep it simple. So we recommend that you keep the program evaluation piece as simple as possible. And here's why we think that. Extensive program evaluation can take a lot of time and effort, which is why it's probably the most neglected part of programming and planning and implementation. We typically, especially in the nonprofit world, just don't have a lot of time. But even more so, we don't budget time for it, as Joe said before. How are you going to have the time to determine data, gather and analyze the data, send out surveys, call consumers and or customers for feedback? Chances are you won't. And as long as the program appears to be doing well, program evaluation at an intricate or official level probably won't happen. So again, our hope is that we get you down to the path for developing a simple model of program evaluation that you really can implement it down the road, as your program and more importantly, your consumers will truly benefit from the solid program evaluation done on a regular basis. That said, those of you with expertise in this area can go as deep into the program evaluation as you want, and you don't have to follow this particular model. Next slide, please. Joe, you all right?
Yeah.
Okay. Go ahead.
All right. I think you can go to the next slide there. We're going to talk about those exact things, how goals are measured, and then how you come up with indicators, because that's really the key to good program evaluation, is if you come up with good questions and then good indicators to measure those questions, that's where the key is. And so what model do you use? As the slide says, there's millions of them out there. You can Google, program evaluation, and you'll go down many deep rabbit holes on the internet. Perhaps the best one and the simplest one that I found is directly from the CDC. We don't have the time to get into all the areas listed as they talk about engaging stakeholders, describing the program, focusing evaluation design, gathering credible evidence, justifying conclusion, and ensuring use. That's a lot to get into in a very short period. So we're going to focus specifically on the focusing evaluation design and gathering credible evidence. Some of them are self-explanatory too, like the first one, engaging stakeholders. That's really just making sure that you're talking to everybody involved who has a stake in the program or service and what they're looking to get out of it. But we'll go to the next slide and we'll focus on, okay, so on the part that's called focusing the evaluation. And that has to do with determining the key questions you and your stakeholders want answered about the program. In other words, what do you want to be able to decide as a result of the evaluation? For example, what determines the program's success for consumers? Success in some programs for consumers might equate to big picture outcomes, such as getting a job or not returning to the hospital. Or they may be more about nuanced areas, such as timely service and support, good communication, receiving quality equipment, and maybe even the cleanliness of the facilities. So what about customers? They may also have specific outcomes. And by customers, I'm kind of what we traditionally talk about as funders, okay? But Patricia has taught us over the last few months to really look at our funders and businesses as customers. So that's why I use that language. But they may also have nuanced aspects, such as the value of service compared to cost or added benefits, or also it might have to do with communication goals. And then what about your agency? What do staff think? Is their time for the program effective? Do they have the training and resources needed? Only you and your stakeholders can determine these key questions. Make sure you ask what's important to your stakeholders in addition to the obvious ones. For example, if the overall outcome is to not have consumers return to the hospital, that's obvious. The evaluation question becomes something like, are we successful in keeping consumers from returning to the hospital after discharge? Next slide, please. So you got to keep those questions specific, but you also don't want to get into really specific details. So they have to be clear questions, but you can't get into the details because that's what we're going to talk about next. And that's gathering the evidence. This is where you determine the really hard part. What indicators are you going to use to measure and have the data to back up and answer the questions you're asking? Okay, so as the CDC says, the indicators should be simple, precise, and measurable. Let's focus on that measurable part. Indicators can't be abstract, such as we provided a better quality of life or better health outcomes. That's not going to really help you. Instead, you must come up with relevant measurable data. So let's think about some examples. And I'm going to move quickly because I know we're short on time. If one of our evaluations questions is, are we successfully preventing customers from returning to the hospital after discharge? What indicators could you use to determine this? Well, as a sample of that, maybe you say, did 80% of consumers not return to the hospital for the same or related diagnosis within 3 months of discharge? You see how we're going to track data that's going to help us answer that overall question. 80% of consumers, that's very detailed and specific, will not return to the hospital for the same or related diagnosis within 3 months of discharge. So we're putting a percentage on there, and we're also putting a time frame on there. Here's another evaluation question. Are we successfully helping young adults transition to employment after graduation, if that is their goal? An indicator for that question might be 75% of young adults have attained competitive employment with or without support within 6 months of graduation. Then we can talk about more nuanced questions like, are we providing timely and effective customer service to consumers? In this case, maybe an indicator is 80% of respondents to a survey responded that they agreed or strongly agreed that services were provided in a timely and effective manner. And so on and so on. You can get into financial questions with this. You can do a lot of data analysis. You can be doing surveys to gather this information. Other things you want to think about for indicators, don't just make up the numbers. You know, if you're thinking about creating an indicator like we talked about, where 75% of the young adults in your program were obtaining competitive employment, why 75%? Perhaps there's a state or a national standard you can use. Do one of your customers or your funders have a benchmark that they want you to reach? Maybe you can base it on existing evaluation data. It's important to determine numbers that will actually tell you something about the program. Also consider indicators that are going to lead you to how services impacted consumers. You know, just the more qualitative things, like one person never worked, but now loves saving her money. That kind of information can help you down the road, not only to show your program success, but help you with marketing. Okay. I think I lost my place, sorry. All right, there we go. Then you got to get out there and figure out a way how you're going to track and obtain this data. And you have to, again, do this early on. It has to be part of your program design. Are you going to set up tracking through Excel or through some sort of database to count the number of individuals who obtain competitive employment in your program, or who don't or do return to the hospital within a certain time frame? If those systems aren't set up and in place right from the get-go, you're going to fall behind pretty quickly. You also have to decide if you're going to do a survey and how you're going to get that information out there. It takes a lot of time to do program evaluation, even at a simple level. And then you have to spend the time interpreting the data and then presenting it potentially to your board and others. So in the end, you know, this process, though, it's going to help you in so many different ways, as we mentioned. And again, it's something you have to think about right from the start. And with that said, I'm going to turn it back to Seth or Patricia or Daisy for any comments on program evaluation that I may have raced through that you want to stress, or additional information.
This is Daisy from Access Living. I mean, I would just stress or kind of amplify, Joe, what you said about analysis of the data. I think I know where Access Living has gotten tripped up. I mean, I feel like for a while we weren't good at evaluation at all. Then we were got pretty good at actually having the plans in place for what we were going to evaluate, tracking the numbers and how we were doing, but actually like putting that data to use. It's like a whole nother step that is even harder. So, I just think that part of it is really important. And in terms of having a plan and kind of a structure set up at your center that's going to allow you to analyze the data, like have processes in place that allow you to analyze the data is really important.
Yeah, very much agreed. And I'd love to spend more time talking about that because that is really key, Daisy. Thank you for that.
I would add that be curious, activate your curiosity. And someone on your staff had an idea that this particular service would be good. Well, let's see, let's ask questions about it. Who used it? How they feel about it? I mean, ask questions that help you evaluate or help answer the question, should we continue? Do we have an impact? Excuse me. Is it going well? I mean, if we did 50% people, if we kept 50% of the people out of nursing homes, is that good enough? That's good information to have. So be curious. That's the put on your curious t-shirt when you're doing program evaluation.
Awesome. And so we do have another question on the next slide. And we have some questions coming in the Q&A that we'll get to here in a little bit. So Patricia and Daisy, how have you used the data to prove success or to market to potential funders or conduct outreach to potential community partners?
This is Daisy again. I mean, at Access Living, each program has its own kind of indicators and outcomes that they're tracking. And then all of that information gets turned in quarterly. And one of the main people it goes to, well, there's sort of two, in addition to just other staff at Access Living, it goes to our development staff who are, helping doing the fundraising. So they directly have the data that they need in order to talk about our programs. And then it also goes to, we do a dashboard that then gets shared with our board of directors. And those have both been good ways to use the data to prove success. Although I would also say, one of the things that we definitely make sure staff are talking about every quarter are what the barriers were that they hit. So, if we didn't hit our numbers in one area, we're not saying like that's a terrible thing. What we're saying is we need to understand what the barriers were that staff person ran into so that we can actually try to go around those barriers, get around those barriers.
Oh, go ahead, Patricia.
I was just going to say, data is power. Information is power. It gives you, it's like a big flashlight that shows you the way, some potential directions you need to go in to make your program work. So data is so important. And in a minute, I will talk about marketing and using that data. So Seth, take it away.
Yeah, I totally agree, Patricia. And I know that we've used data for a whole lot of different things. So maybe one thing to show our staff that are working in that program where things are or where they need to be. So we've done things with that. Maybe we've used data to go to a potential funder and say, hey, we're looking at this and this and this, and that might help prove where you need to be. Or then even using some of that data for other future funding, maybe grants. And like, I know we've been able to put stuff into grants that might be able to help supplement some of the other things that you're doing too. So Totally agree, Patricia. Data is that power.
Okay, I'm gonna reach out, go to the next question. So Mary, okay, so I'm let Mary handle that. But one of the things that we've done, and it's in your, it's one of the documents that came with this, is in your packet, so to speak, attached to this recording. In our hospital to home program, we collected quite a bit of data. And we went to, at one hospital, and we went to another hospital who said, and we wrote it all in words and percentages and all that. And they said, hey, we want pictures. And we're like, pictures? And it occurred to us that they were asking for an infographic. And in your packet, you will see the infographic that we put together for Centura Hospital in Colorado Springs. And it talks about things like how much annual savings per patient. So the average savings for any patient that we worked with was $14,000. And over 2 years, we projected we would save them $840,000. We talked about how much it cost per patient and the number of days. We talked about payers. Who were the payers? We had 58%, 56% of our payers for this for insurance, including no insurance. We could show where the insurance or no insurance was coming from. And in our program, the biggest group was the under or uninsured. 56% of the patients that we worked with, people with disabilities, did not have insurance, and we were able to work with them to get on Medicaid, whatever we could do. So that kind of data really, particularly for your customers, the people who are paying, they want to see the impact. They want to see the impact on your bottom line. They want to see the impact on the consumer as well. But really, if you're going to a business selling a service, they want to know how it's going to impact their bottom line, and you have to have the data to support that and show it. So that's how we've used data. We have a report annually on the hospital to home that talks about the demographics. It talks about the types of disabilities and conditions, how long they were in our program, and how many people were readmitted, which has been very, very low. And having that data has really helped our current contractor, continue the contract. And I have to say, when I proposed this program, the CEO of the hospital hardly even spoke to me. A year later, he came up to me at an event and gave me a kiss and said, this program is great. And it's all because of data. I mean, our performance for sure, but we had the data to show him what we were doing. So that data, you can do a lot with it in marketing. You can do a lot with it in terms of evaluating whether you've met your goals, what do you need to tweak. As I say, data is power.
Thanks, Patricia. This is great. We're getting a lot of questions about data in the Q&A. So our first one is from Sequoia, who asked, has anyone tried using a service learning program as a resource for collecting data for program evaluation?
We haven't at Access Living.
No, we haven't either.
So I'm not sure what that is. Maybe I'm the last one to know, but I'm not sure what we're, a service learning center?
Yeah, Sequoia, if you could provide more information, I'm also not familiar in the chat.
Yeah,
Maybe we
Brooke,
could come back to that question.
yeah, Brooke, I'm assuming, I mean, there are some software programs out there that help you choose data and based on program information and things like that, and then also help you see trends. It provides you with automatic trends and things. One of them is a French word that I can't think of right now, but there is software out there. Oh, there's Sequoia. She can tell us.
Hi. So a service learning program is actually uh, a program that is in partnership between nonprofits of a community and a local community college or university. And what they do is it provides credits and hands-on learning for people going into like human services or social work, and where they come in and help nonprofits for things that they don't have enough manpower, such as program evaluation. So it's a win-win for everybody, essentially.
That's great. We've taken advantage of lots of programs like that, but never for program evaluation. So I appreciate that thought very much, because that could certainly be helpful.
Yeah, that's great. Thanks so much, Sequoia, for explaining that as well. And we have another question that's anonymous. My question is, are there resources for meaningful ways to use the evaluation data we collect? That's where it seems to break down at my SIL.
It's a good question. I mean, these are really good questions. I think to me, it breaks down because of the effort and time it takes to really analyze it and use it effectively. It's not, I don't know if I can think of any resources that help you with that evaluation and analysis of your data. I don't know, Daisy, Patricia, anything you think of, or Seth?
Yeah, this goes back to what was Sequoia was suggesting. You know, you can go to your local college. I'm pretty sure they have a statistics program there. And they will welcome projects that students can work on to help you set your data up. Or if you have your data, help you interpret it. And so to me, that's a great resource if you're looking to do this without paying very much. You can always hire a statistician to help you, a program evaluator. They're out there, and in United Way or your local nonprofit association will be able to help you with that as well. Those are two resources I can think of.
Yeah, I would just add, taking a step back, if you've engaged stakeholders from the beginning in this process, then it becomes more natural, and it just happens that you share that data better and you use that data after the fact, because your customers are going to want to hear about the data they were interested in, and your board's going to want to hear about the information that they were interested in. So if you're engaging stakeholders and coming up with good relevant questions, that should happen a little more naturally.
This is Brooke, and I'll just chime into a lot of the survey tools. They have like a reporting feature. Things a little bit easier if you're just looking to get started, and so they can pull together these nice reports that sometimes let you filter out partial responses. And so there's the one that comes to mind is Survey Gizmo, Alchemer, Qualtrics. I mean, there's just numerous tools out there that have really nifty and user-friendly reporting features. Awesome. And we have, I know we're running short on time, so we have one other question. So for those at SILS who have implemented program evaluations, what has been most helpful to gain knowledge, guidance, and support for getting started with evaluation and troubleshooting along the way? SIL peers, training, outside consultants, etc. And this is from Tracy.
So I would just say, go back to something that Joe and Zeth said, which is keep it simple, especially at first, and maybe like try piloting something at one program in your SIL. I don't actually, I mean, if you have the money, you can use an outside consultant, of course, and that probably would be helpful. But I don't think you should see that as an impediment to getting started. I think you can totally get started without that. There's lots of good resources online. There's good resources that I think Seth and Joe and Patricia have provided about program evaluation. It doesn't have to be complicated. And I would just say start somewhere small at your center.
This is Joe. I would agree 100% with that. A lot of what I learned about program evaluation was trial and error and learning how to come up with good questions and good indicators. And that CDC website we mentioned before, it's a great tool. It's very simple. They use, you know, very concise language and keep it very simple for you to follow. And I would also just say, like, the best thing you can do is engage stakeholders in the process. Don't try to do it alone. I think that's a mistake many people make. They come up with data and they think, you know, oh, this will work. This will tell us if we're successful. Ask people what they want to see for that program to be successful, and you'll have a better time.
And there might be some friendly skills out there that might be able to help you along the way a little bit.
This is Mary. I think we're happen to be looking at a few of them here. So in the last minute here, Sandra is wondering if anyone is willing to share their strategic plan. And if that is so, you know, we would be happy to post up with the website materials, or we can hunt Sandra down and send it to her. But yeah, that would be really great if we could offer that. And I just wanted to say thank you so much to all of our panelists and to ILRU and the ILNet for sponsoring this session. We do, speaking of evaluations, have one in the chat box for you to fill out, and there will be one that shows up in your browser when you close this session. It's the same one, so you can choose either way to do it. And awesome. Daisy says that she's willing to share their strategic plan. So we will put that on the website along with these recorded materials. Thank you, everybody, again, and have a great evening.